is the over-the-counter medication setting. In order for us to have the convenience to get over-the-counter medicine without the prescription from doctor, we have to have some knowledge about the medicine. And also, it was never designed to take away doctor's advice, which is particularly take patients' personal condition into account, which is much safer, specific, and effective that way. And the second thing I want to mention is Tzu Chi Foundation, nor myself have any financial interest with any of the company, pharmaceutical company mentioned today. And for the convenient purpose, we just talk about the company used name. And sometimes this is a generic name, sometimes it's trade name. So, but it's just for convenient purpose. Okay, so today's topic is under pain management umbrella. So pain management is many areas. Today's focus is talking about over-the-counter medication. But pain control and pain management we talk about has many other areas that will affect us to achieve a better result, which is not mentioned in today's topic. It will discuss in separate settings. Next slide, please. So pain medication, some of them we can use over the counter, other is particularly prescribed by the doctors. And today we only talk about over the counter medicine part. Next, please. So once again, today's main purpose is us to talk about this so we are more familiar with that medicines, and therefore we have less risk about this. This aim to be a treatment for a short time, and it was never planned to replace doctor's decision, and we should be a part of that for us to work with the doctors and not to replace them. Next slide, please. There's other particular medication used in different pain situation, and it is not in our today's topic. For example, we didn't talk about topical medication. We do not talk about urinary tract pain medicine nor stomach pain medicine. Those are specifically different conditions. Next slide, please. So the first medication we'll particularly talk about is one of the most common used pain medicine. We can call it Tylenol, paracetamol, acetaminophen. Tylenol is just the trade name, yeah. For convenient reason, we just mentioned this. For this, we particularly want to mention is there is a maximum safety dose for daily use for adult, and we do not use the medicine more than 4,000 milligrams a day. However, there is a patient, most people will recognize 3,000 milligram limitation as a safety maximum. The reason is this is particularly important for consumer protection because there's a lot of over-the-counter medicine that already has Tylenol as a part of their ingredient. And to avoid the overdose accidentally by taking multiple over-the-counter medicine, and therefore the 3,000 milligram was used as a daily maximum dose. Another thing commonly we should talk about is Tylenol, among many other over-the-counter medicine, is a little more safer to be used in pregnancy. The common side effect for Tylenol is upset stomach, but we will talk more about this particular part. And this is common regarding Tylenol itself, because Tylenol has relatively few side effects. But we always concerned, and when it was not using appropriately, let's say in an overdose situation, and we particularly worry about liver damage. Next slide, please. So to clarify and about side effect, we particularly want to mention that when we discuss, we usually say, yes, what is the common side effect, right? And because even the medicine is quite different. And so the side effect, different people experience different side effect, but majority of us don't experience that much side effect. So when we mention possible side effect, we usually mention the common side effect. But also we trying to alert people so they understand there is a potential with some severe side effect, although they may be very, very rare. So actually, do patients have side effect or not? Depends on the dosage, the personal response, and if you have any particular disease or you're taking any other medicine, so on and so forth. Now, drug allergy is totally different than side effect. All medication can cause allergy. And if the simple, mild form of allergy is maybe just itching or rash, but when severe, it can be life-threatening. So these are the common things we want to mention. And as you can see, side effect is not a black or white situation. It is, the data will show us commonly this is the situation, and doctor had to think about how in particular situation, in your case, how to minimize the risk. And so here we particularly mention about this. Next slide, please. The second medicine we discussed is ibuprofen. Ibuprofen is a part of the category of medicine we talk about as an NSAID, yeah? So we just use it as an example, but also in this category, over-the-counter medicine of naproxen, also in this category, and so is aspirin. The special part about this category of medicine is not, they don't only reduce pain and fever, but they also reduce inflammation. So the commonly used dose actually on the over-the-counter is 200 for children and 400 for adult. We particularly mentioned that there is prescription dose is slightly different. Many people frequently ask me that how come you give the dose different from the recommendation from the bottle over-the-counter medicine they bought? That's the reason. Prescription dose usually allow it to be higher because doctors know about the situation. The important points to mention about ibuprofen is we do not use ibuprofen in newborns, yeah, and in pregnancy condition and the later part of the pregnancy, it is not safe to use ibuprofen, and therefore, please particularly talk to your doctor when you need to use ibuprofen during pregnancy. Ibuprofen has a little bit more side effect, more common than, for example, Tylenol. And the common side effect is upset stomach, it irritates the stomach mucosa, and we can get a little bit bleeding, and we can get a little bit even ulcer. If we get large dose long enough, and sometimes we have higher risk of getting severe internal bleeding and even kidney damage. And these are the things we particularly need to pay attention to. Next slide, please. So aspirin actually is similar to ibuprofen category. However, this medicine, besides pain control and fever reduction, it also have an antiplatelet effect. So many patients call it blood thinning, and that's the things. They reduce the blood clot effect, and therefore, actually, it will increase the bleeding tendency, right? So those are the things we particularly want to remind people about. And again, aspirin we particularly don't use in children because in viral condition and children can have a severe complication. And since many times we cannot tell and what is a viral condition and over the counter, we don't usually recommend. Again, we don't usually use aspirin in children. The side effect very similar to ibuprofen, but it tends to be a little bit more common. Next slide, please. Next slide, please. Thank you. Why we're using the over-the-counter medicine, we particularly need to pay attention in several things. The most important is we will definitely prefer patient has agreement with the doctor, say under the certain situation, how do you use this medicine? And if you don't, then we need this basic knowledge, and we try to strictly follow the basic recommendation by the over-the-counter medication instruction. When we use medicine for pain control purpose, we need to think about what is the main focus of our treatment. And so pain is actually a signal that's designed to protect us. So when you have pain, and that's a lot of times our body's signal to tell us if the injury. That's why we don't move when we have a lot of pain, right? Because we're trying to recover. So once we already know this pain, then it does not serve the purpose anymore. Now we use pain medicine to control it so we can have better quality of life. Another thing we need to pay attention to is we try to use the minimal effective dose. And frequently, we don't just say adult dose or children's dose. If you are very sensitive to pain medicine, a lot of time, lower dose still do the job to reduce the pain, but it might be has less percentage of patients that produce the same amount of pain control quality. Once again, this is for convenient purpose. It does not designed to replace the doctor's advice. Next slide, please. Meng, can you turn the next slide? All right. So once we know about the medication and the common information, and the most important is this is the most important slide, and show that how do we make a choice, right? So when patient has a liver condition or if they have they drink a lot of alcohol, and then we need to worry about do they able to process so many Tylenol type of medicine. The choice, and we would prefer ibuprofen type, right? And if you have stomach problem and a kidney disease, a bleeding problem, and in this situation, we particularly worry about the side effect of anti-inflammatory medicine. So we avoid ibuprofen, avoid aspirin in this situation. The common choice, we would prefer Tylenol. And under pregnancy condition, definitely we would prefer Tylenol as a little safer version. So when we choose medicine, if it's a typical pain condition, we indicate for this over-the-counter medicine, and like headache, muscle pain, joint pain. And so we can choose anyone. But again, Tylenol, because it's less side effect, and we commonly use that. Ibuprofen and aspirin has a more pain control result in many of our patients, and they will rather use that, and if they can handle the medicine. If it's inflammatory pain, we will particularly like to use ibuprofen type, the previous slide product. The inflammatory pain, and also if it's a toothache, menstrual cramp, this kinds of condition, ibuprofen is better. One more time, I will just particularly mention if it's stomach pain and it's urinary pain, and if it's this kind of situation, it is not, we don't use this medicine. That's totally different other category of medicine to use. Okay, next slide, please. One more precaution again is in pregnancy, it is actually early pregnancy, we try to reduce the chemical as much of exposure to medication as possible. However, Tylenol so far is the safer one to use. And so even the reproductive age women will always be very, very careful about using medicine. In terms of the children, so because they are not very mature, their body, they can, we are particular, and also they do not communicate very well. We have to be very, very careful that they might have other things that it is not just like pain medicine can control, take care of that, right? Next slide, please. All right. So for pregnant women and children, we particularly has a low threshold to consult doctor, and we have more careful about this. Next slide, please. Okay. Several more precautions about using the over-the-counter medicine is many over-the-counter medicine already mixed with the ingredient. And so when they mix, we can also mix medicine by ourselves. For example, we can take a low dose Tylenol and a low dose ibuprofen together to produce a better result and has less side effect for pain control purpose. And as I mentioned, many other over-the-counter products already add pain medicine inside that already. So please pay attention to the label, how much content of the same type of pain medicine is there, so we don't get overdosed for that purpose. And same category of medicine will increase the risk, like ibuprofen and aspirin used together, your bleeding risk is increased, yeah? And last one, fever, we usually use this pain medicine for fever control purpose as well. But in children, be very careful. We don't use this medicine to control fever before they are 3 months old, because at that time, fever usually indicate a lot more serious infection, and we don't just use the over-the-counter medicine. So most important of the topic here today, if you don't remember anything, remember when you need to see your doctor or even go to the emergency room. So over-the-counter medicine is not enough when, number one, you don't have a good result. Number two, you have allergy or you have very bad side effect, right? So number three, if you have very severe complication, for example, you have heavy bleeding, you have severe abdominal pain or severe symptom that doesn't make sense, you should go directly to the emergency room and to make sure we don't have a severe complication. Next slide, please. Once again, pain medicine is, pain control has many aspects. Pain medicine has its limitation, right? You know, we didn't talk about pain perception. We didn't talk about the reason what caused pain, and we would try to discuss those in other occasion, yeah? Pain recovery and pain therapy, all these are exciting topics. We hope to have an opportunity to talk about this later. Next slide, please. Okay, so if you still feel very confused about what today's talk about, what we talk about, and this is slide will help you to make some decision. If not, please talk to your doctor. Remember, once again, over-the-counter medicine is for our convenience, and it doesn't replace the doctor, right? So if you find this information very simple, then congratulations, you have the basic understanding of the over-the-counter medication use, and hopefully it will help you to take care of the problem and with some convenience. That will be my presentation today, and hopefully we can, if you have any question, we try to answer, and hope that we can help you. Thank you.
Great, thank you very much, TC. I think it's been very helpful, especially for pain medication. It's certainly something that I think everybody looks forward to learning more about. We have a couple of questions here. We have a question here from Joyce. For arthritis, which pain medication would you recommend?
Okay. All medication can be used for arthritis. The same thing, headache, arthritis, pain, like joint pain and muscle ache. All these, you can use Tylenol, you can use aspirin, you can use ibuprofen, make no difference. Well, I'm sorry, okay? It's your personal choice, okay? However, Tylenol is a commonly underestimated for its effective in arthritis. But for most people, ibuprofen and aspirin, they tend to work better and in much more severe case of pain. Yeah, so again, there's no definite choice. Yeah, it's your personal condition, and you make a again in over-counter setting, see which one you work well with, and if not, then you probably should talk to your doctor.
Right, and just out of curiosity, I know some people say they've taken this so many times that they seem to have to increase the dose forever. And I actually worked with someone in the past, and I know that individual took a lot of Tylenol, and those Costco-sized bottles, they're quite large, and they go through them like as if it's gummies or something like that. But in terms of tolerance, do people actually build up this tolerance? So now if they have pain, they actually need to take more? Is it like, I know it's not safe to take acetaminophen to a certain degree, but like what should people do? Like, should they alternate? Should they combine? Like, what would you say?
Okay, now same thing. We talk about the same thing again. But you first answer the question. There's multiple parts of the question. Now, number one, all medicine, okay, after you're taking a while, they have a tendency, they might not be quite enough, right? So you especially take a lot of them. And so watch several things. Number one, if you're over the recommended dose, particularly ask your doctor, okay? If you're not familiar with that, if you don't already have agreement with your doctor, please ask the advice from the doctor. And there's many, don't forget, pain is a signal. If you are fully understand what the pain is, like chronic pain, you already know, doctor already well researched, already well studied, then they will just focus on pain relief, right? So that's much easier to use medicine, that's vocation. But for us, if you keep having a lot of pain, popping the pill is not enough, right? Even if safe, it might not be enough. It might be other things going on. So you need to ask the doctor for that purpose.
Makes a lot of sense.
Another reason is that's a commonly used strategy. If you have already tried to combine the medicine and it doesn't work very well, maybe there's other method, right? We already mentioned that's a therapy. Sometimes maybe better than physical therapy, acupuncture, and other things might be more effective. Or it is a condition so bad that you might need surgery, okay? You might need other treatment methods, much more effective, right? And as we mentioned, it might be a sleeping issue. You don't recover because you don't have enough sleep, for example. Your emotional condition or other issue. So when things don't go well and you already tried that, so it's time to see your doctor. That's why this limitation of over-the-counter medicine, we have quite a lot of limitation actually.
Right, totally makes sense. And TC, just out of curiosity and a topic really sort of relating to the current times, if people are exposed to COVID-19, and obviously one of the symptoms is having fever, like should they still take over-the-counter medication for controlling pain as well as fever? Is that what you recommend?
Okay, that is a specific COVID question. Number one, again, COVID, when it's really, when you have severe symptoms, let's go to emergency room, like when you're shortness of breath and your color turn purple, blue, indication of not enough oxygen. And besides shortness of breath, chest pain, these are go to emergency room. This symptom, you go to emergency room. If not, you go to see a doctor. Doctor is like, I'm not going to see you. I'm not able to help you because there's no treatment for this, right? But to reduce fever, reduce pain, whether it's COVID or not COVID, you can use this medicine to reduce this. When it's either flu or COVID, make no difference. You can use this medicine to reduce discomfort. But this is not help you in terms of treatment. It's help you for pain and for symptom relief. Yeah. So that's the purpose.
Totally makes sense. Totally makes sense. And I know, TC, you've been involved in so many of our different programs, and I know you have techniques to sort of help people combat pain, like, pressure points and different, exercises that we can do. And you sort of mentioned that at the beginning of your presentation as well, that, there's so many different causes of pain. What do you recommend just on a day-to-day basis? I know a lot of people experience pain, various different levels of pain, various different causes of pain, but what's generally a good sort of day-to-day healthy practice?
Brother, that question need another topic to discuss about that. Yeah. So again, today's focus is over-the-counter medicine, pain medicine. So we have a pain management aspect. We need to talk about what causing the pain, right? So how do we prevent it? And how do we make ourselves stronger? So when we experience the same injury, we don't experience the same amount of suffering, right? So those are very important. For about recovery, now, so if you don't have enough sleep, okay, you don't have a good posture and so on, good habit, lifestyle issue is the main reason of this pain discussion. So all those things are important. And all this is assumed that you already investigate the reason for pain, right? So you don't have something bad underlying issue that is there. Yeah. But again, medicine and it's a humble job. When things don't go well, we always think, can I make a wrong decision, right? Even the doctor always think that way. Do I make a wrong diagnosis? Is there any possibility something else is going on? So because human body doesn't always work that simple, right? There's a lot of a special situation. So we always be so cautious. Something may go wrong if things don't go well. That's why we keep advise people, talk to your doctor when the recommended condition is not helping. Yeah.
Great. And we have a common question here as well. Like in terms of, we talked about the Tylenols and Advils that are very traditionally known as common brands or types, I should say, representing to the acetaminophen and the ibuprofen. But, a lot of us who have tried herbal medicine, for example, it also has a label on it that says it's effective against pain. In your experience, like how do they compare? Like, is it a better remedy for people that have these pain problems, or like long-term wise, like TCM? We generally think about it as something that could be less harsh on the body, etc. Like, what's your take on these different types of over-the-counter and very different types of pain relief?
Okay. Today's particular we talk about is oral pain medicine commonly used, not including supplement. That's a different category, and not including topical, right? So for over-the-counter herbal medicine and other Chinese medicine for particular pain use, the quick answer is because I don't know enough about herbal medicine, I don't know enough about Chinese medicine and so on. So I don't have an answer for that. And this actually, I particularly push my acupuncture colleagues and Chinese medicine colleagues to particularly discuss this. You will notice many doctors, many companies, or many clinics, they will avoid many of these topics like this because we can offend many people and or company or get into trouble. But I particularly like to make this presentation is because I get asked so many times by my patient. And all I want is give the basic guideline for my patient so they can benefit from this. So for that reason, I will not able to tell you about how do you compare and combine the herbal medicine and so on, because that's not my specialty. I just don't have the knowledge. I'm very ignorant about herbal medicine and Chinese medicine.
That totally makes sense. And GC, there's a question here we have from Bessie on the line here. And I think this one a lot of people can relate to. If, on the bottle you read it, it says essentially a dosing for adults, let's say 2 to 3 every certain amount of hours. So like, what are they referring to in terms of adults? Like, if you are like for myself, for example, I'm not a big person, not tall or anything like that. Like, do I stick to that range of the dose? Do I, reduce the dose? I think Bessie is specific asking, like, do we actually like break apart a pill and take half? Like, what do you think?
Okay. That's wonderful question. Okay, this is also another very commonly asked question. So if you look at the instruction, they usually use 2 things as a guideline. Number one, it is about the weight, right? So like typical, but if you are 50 kilo, already that is a lot of time we use adult dose, right? And people over 12 years old, a lot of time they can, we look at the weight. If you calculate that, and that will be, many people use that as a guideline. But if you look at it, most important, because we talk about over-the-counter use, and therefore we usually respect the instruction in the over-the-counter label, because they take into account that multiple other conditions in the over-the-counter situation. So that's the correct answer. Okay, but now practical answer to that question is we should try the lower dose to start with. Okay, especially if you're concerned, if you are not having particular experience with it, try the lower dose. Guess what? A large portion of patients already benefit from the lower dose. You can always increase the dose as among the recommended range. You can increase the later. See, if I take the pills, Tylenol, it doesn't quite help me. You can take a little bit more now, or you can take a little bit. You need to wait for medicine to work, right? So 4 hours later, which the medicine is 4 to 6 hours, right? So you take the medicine higher dose a little later within the range.
Okay, and we have a pretty interesting question here as well. In terms of driving after taking this type of pain medication, I think sometimes people are curious, like, is it still safe for them to operate a vehicle?
Okay, good question. So do me a favor, look at the label. If it's just pure the pain medicine itself without mixture of other things, it's safe. All the medicine we mentioned today, they do not cause drowsiness, and therefore it's safe to use under the condition of driving, right? Now, many times these medicines are mixed with other components for common cold. Therefore, they might have antihistamine that cause drowsiness. So be careful in those situations. Another one, remember, over the counter, they commonly, there's a common brand, you say Tylenol PM or Ibuprofen PM or things like that, Motrin PM. All this, they have added components of antihistamine to help us reduce the, the purpose is to use the side effect of the antihistamine to help you sleep, right? That is, of course, we get into trouble of drowsiness and or reduce our reaction time, right? It should not be taken other when you need to drive or when you need to be, in the daytime. It's not recommended. So if they are, especially those who say PM in the back, so be careful, look at the content. They are not pure that medicine. They also add some other medicine that can affect your alertness.
Mm-hmm, mm-hmm. And in terms of, when we look at sort of people wanting, obviously, immediate effect, when you take pain medication, sometimes you want the pain to go away, like really quickly. And sometimes people will try on like an empty stomach. Like, does that actually make it more effective or more effective more quickly?
Okay, so let's say the main concern here, and it is about safety. And if you just want to work right away, many of this medicine that's, especially if you have already experienced it, you will know, okay? But many of this medicine that's, it might give you more irritation in the empty stomach. So we always recommend patients take that after they eat. And empty stomach doesn't make it absorb better. The effect is not so obvious for me and for most patients. So we don't usually recommend to increase effectiveness by going empty stomach. You can try other things, and medicine take time to work. Okay, it doesn't change that much for you to, after you take the medicine, right? It doesn't make that big a difference. If that is the case, you probably need doctor's help instead of just take care all by yourself.
Mm-hmm. Makes sense, yeah. And we have a question from Joyce. So Joyce drinks a lot of coffee, I suppose, and when she sleeps in and wakes up with a headache, it would take a couple of hours of drinking more coffee for the headache to go away. So what kind of pain meds would you recommend in those cases?
You can use all these medicine you can use. Okay. However, this you have to understand that a lot of time that's a typical caffeine withdrawal headache. The better medicine probably is coffee or some other caffeine-related drink, right? Caffeine is also a pain medicine, especially for headache in certain conditions when they mix, right? So, but in her situation, these are commonly presented coffee withdrawal headache. Any medicine that you can use, again, same selective criteria, same precaution. And but also you can, if you don't want to use coffee, you don't want to drink more coffee to counter the headache, yeah, you can try some of the pain medicine. Either one, any of these would be working. Okay.
Perfect. Yeah, absolutely. And and then we have another question here, which it's a good one because I got asked that recently. I had a very dear family member to myself who had surgery as well, and this question comes in the form that we know what causes the pain, but like after surgery, for example, is it better to actually not take the painkiller and then just kind of hold and just put up with the pain?
That's a personal decision, brother. Okay, so number one, when you already know what causing the pain might not have that much benefit anymore as a signal. And when you quite know what causing the pain, you can take the pain medicine control to reduce the pain at least, so you have better life quality. To whether to take the medicine, you don't have to take the medicine. It's purely for symptomatic control purpose. And people have different preference, right? And also remember, pain is a complicated issue. There's many aspects to reduce pain, not just by medicine. Okay, they just one of the convenient way to do so, but it's not the only way. And we have to think about that, right? But purely when you have like patient have doctor prescribe you medicine, that's easy. Okay, you take the medicine accordingly. But if not, then you can make a decision whether to do that.
Great, thank you. Thank you very much, DC. I think we're just getting some feedback on another line here as well. I obviously want to encourage everybody to be able to ask any questions that they may have in our chat box right now. If you do have a questions, please put it forward to us so we can have that answered. In the meantime, we just have one more commonly asked question actually for TC. And in terms of, long-term side effects, I know we talked a little bit about this, and also talking about from a physician's perspective. Just now, we talked about, sort of pain, should we hold it, all that kind of stuff. But it kind of goes back to when we say the adult labeling on the actual bottles itself. But what if your doctor actually says, you know what, we really need to get you more, and you sort of exceed the dose, and it seems like on the bottle it's not safe. Do you still follow the physician's guidelines? Like, a lot of times, people are also confused with different types of Tylenol. There's Tylenol regular strength, extra strength. There's Tylenol 3. Can you give us a bit of a breakdown as to what these different forms of Tylenol really is?
Okay, so that question come from my patient as well, because they mix over-the-counter medicine and prescription medicine together. So over-the-counter medicine, the acceptable range is quite low, and beyond that is always the prescription level. So if the recommendation of the over-the-counter medicine has conflict with your doctor, number one, that's the doctor's decision is specific, personal to your situation, and that should be followed. That's number one. Number two, we mentioned several times, and I always talk to my patient too, that whether to take medicine, how to take medicine, depends on several things, and especially like treatment goal, right? And I always encourage patients to talk to the doctor, communicate with the doctor. It's a partnership. Okay, it's not about the doctor say this and you always follow, right? So when you have a concern about the medicine too high a dose, especially that, talk to your doctor. Hey, doctor, would this be safe? What do you think? By your experience, is this a safe dose? And also talk about treatment goal. If the treatment goal is control the pain to an acceptable level, and we can use other way. If you're not comfortable with medicine, and especially with the side effect or with a possibility of a long-term side effect, then you particularly mention the doctor. And I'm really worried. Can we try other way? Is there any other way that can reduce the pain without taking that much medicine? And we said, what's my option? Okay, so we are partnership. That will make things much more effective, safer, and more comfortable. if you have so much worry and you don't discuss with the doctor might not aware that's your main concern, because treatment goal is important. Yeah, it's not always about pain free, and lots of times it's about pain reduction. Yeah. So these are all the this is so many things to consider, and nothing replaces good communication between doctor and patient.
Mm-hmm. Makes sense. Yeah. Yeah, totally makes sense. And we got another question here. If the pain can be tolerated, and sometimes we just have little pains and aches, etc. It can be tolerated. Do you recommend that we still take a painkiller? Like what is the pros and cons of taking painkillers often, right? Because now you're saying, hey, there's minor pains and aches, but I don't want to put up with it, so maybe I just take a painkiller anyways. But now you're building a long-term habit. So would you recommend in these cases, still go ahead, take it, or if it's tolerable, you know what, we're just going to tolerate it and not actually take a painkiller? What do you think?
Okay, so if it's tolerable, doesn't mean desirable. Okay, so if it's tolerable in your personal philosophy, my personal preference, I don't quite always take medicine when things are not that severe, not that annoying. It doesn't affect my function. I pay attention to more about function than pain-free. So that's my personal preference. So as long as it's safe, it's okay to use the medicine. But if it's but you have to also understand, pain response is a very strange thing. There's some patient population, if you don't take care of the pain signal, if you chronic severe pain especially, and if you don't control it, then you become a constant abnormal response, that you have hyper pain response. You are so sensitive, and that's not good. And that's definitely not the situation we talk about now, because you say tolerable pain. All right. So when it's tolerable pain, at the same time, you understand a lot of pain medicine, when it's accumulated enough, when you take so many of them, the medicine slowly become not as effective. That's why many doctors will ask you to do medication holiday, or we call drug holiday, right? So we purposely don't take the medicine for some time, and or stop them for a certain amount of time. Then when we take the medicine again, it becomes more effective. So that's another situation. Once again, we're talking more specific situation. Those better conversation is better be the conversation between you and your doctor. But I just give you my perspective. When I is patient, or when I is provider with my patient, that's the frequent things I talk to my patient.
Okay. And we have another question here as well. Like, how when people prepare for like a really important event or something that they have to sort of, they're worried, right? They're a little bit, tense, let's put it that way. And then they want to, sleep better in terms of, relaxing the muscles, etc. Now, obviously there's a distinguishment between muscle relaxants and, painkillers, but, what if, someone says, hey, you know what, I just want to be less tense so that I can sleep better because I'm just worked up or really concerned about an event that's going to happen tomorrow, which they spend a lot of time preparing for. Like, would you say, you know what, take a painkiller, it's fine because they don't do it often? Or do you say, hey, you know what, let's try some other way?
By the situation you described, and it's already not the indication of the over-the-counter pain medicine, right? So in this situation, that's actually many other more effective methods. So we don't just, because the topic, right, we always go back to the medicine, but don't forget, pain medicine is just one aspect. And in this describe that situation, definitely not the best option. I personally would not recommend that. I would much more recommend other methods, meditation, breathing exercise, and there's so many other things. There's physical therapy, and more important, if the patient concerned of something's going on, calming the calming the mind is more important. About make sure we actually find out it is safe. I'm sorry, there's no other things going on. That's a big big thing to consider. And then we talk about other methods to more effectively deal with the situation, not just a painkiller.
Right.
Painkiller is not replace everything. Yeah. Mm-hmm. Otherwise, it's not Harry Potter. Yeah.
Mm-hmm. Yeah, absolutely. And well, we got two other questions. I think these are probably going to be our last two questions before we wrap it up for today. The first one is it okay to take medication, especially these pain medications, with grapefruit juice? Because there's so many medications out there that I hear about that if you take it with grapefruit or grapefruit juice, it may, exemplify the effects of the medication. So is it safe to take let's say Tylenol or Advil or any of these brands or these painkillers with grapefruit juice?
There's a lot of drug-food interaction, and so in this particular case, I need to get back to that question. For Pacific grapefruit, I'm not so sure. Okay, I have not particularly looked at that particular one, so. I cannot answer at this moment, but I will get back to the make sure you have the contact with the patient. I particularly get back to that for this.
Perfect. Yeah, I think that's probably something that we can update everybody on our Facebook. So please do check our Facebook, and we'll make sure that TC gets us everyone the answer. I'm curious myself. So, and we have one more question from Bessie as well. In terms of Bayer painkiller, I think she's referring to specific that brand. Like, are these still available OTC?
Yes, aspirin is we use it less, not because it's not effective. Actually, aspirin is a quite effective pain control, and however, it tends to have a little bit more side effect in terms of bleeding and stomach irritation and so on, and cause for ulcer and so on. And so we are more cautious about using it. It's similar category with ibuprofen. It tends to have a little bit, it tends to have a little bit more strength in terms of pain control, and also a little bit more side effect. And therefore we use with caution, but over the counter is still available. Be careful. Today, when we talk about aspirin, we particularly mention there's a different form. If you look at the slide, the low dose aspirin, like 81 milligram, 100 milligram, 75 milligram, these are called antiplatelet dose, right? They are used for blood thinning purpose. They are not so effective in pain control. We call it baby aspirin, right? That's why, because those so low. And many of them, they're enteric-coated, and therefore it will not absorb in your stomach. It go to the intestine, then you absorb to reduce side effect. So they're not strong enough for pain control, and they might help you. I don't know, but for most of our patients, they need 325 milligram to be benefit in terms of pain control dose, or even higher in 500 milligram. But you can use it with same precaution, yeah.